the Good Girl Podcast. I am Cameo King, your host of the Good Girl Podcast, the podcast of women's confessions about our flaws, faith, femininity, and culture. I am all about healing women and freeing women from regret. I am all about helping women live free and live in their authenticity. And for me, I believe that starts with an honest, raw conversation. A confession is what I call them. And so every week we have a woman on sharing a confession of truth, a messy part of her life, but that she has healed through and that she has no regrets from. This week, though, it's going to be a little bit different, right? We talk about culture on the Good Girl Podcast, about things that affect our livelihood, things that affect who we are and how we show up in the world. And I believe one of the most pressing conversations that has been happening around us, to us, with us, in our chat groups, with our family, is the concern over whether or not we will decide to take part in the COVID vaccination. And when I say we, I think it is a different story for Black families, for the Black culture, as well as other communities of culture. I have a couple of family text groups, and the conversations have been interesting, as well as conversations with my friends. And so I really wanted to have somewhat of an informed conversation from folks who do this work, folks who are familiar with this work, folks who work within the community, the health community, who are in charge of potentially coordinating and making sure the right people in the community have access to these vaccinations, right? The folks who are briefed from the federal level on what's happening with these vaccinations. And so for that, I tapped the Ingham County Health Department in Lansing, Michigan. It is one of the health departments in the state of Michigan. We are located in Lansing, Michigan, and they have definitely been a great partner with the Good Girl Podcast. And so for this conversation, I'm first going to bring on Debbie Edokpolo. She's been on the Good Girl Podcast before. She owes me a confession. I forgot about that. She owes me a confession. But Debbie is the health officer at the Ingham County Health Department. Debbie, welcome.
Thank you, Cameo. And I'm the Deputy Health Officer over Public Health Services. And I do owe you a confession.
You do.
So let me just start with my confession. So I have 2 days left to be at the Ingham County Health Department.
Wait, what does that mean? I have 2 days left to be. What does that mean? Tell the people.
So I have decided to retire after almost 32 years. And so January 29th is actually my last day. And I thought how befitting to have my last week to have some time spent with you and those who listen to the Good Girl Podcast. I'm really excited. And also today is my birthday. I'm 60 today. So it's like this is an all around great day for me.
It is, Miss, let me get it correct. Miss Deputy Health Officer, right? Did I get that correct? Well, happy birthday. That's one. Happy retirement. That's two. Thank you. You look gorgeous. 60 where is what I want to say.
Oh yeah, listen, I'm driving 60 now. 60 ain't gonna drive me. I'm driving it. So I'm excited.
You better drive that thing. So I'm excited to have you a part of this conversation. And what a great way, in my humble opinion, to leave the people with the wisdom and the knowledge that you have gained throughout your time at the Ingham County Health Department, but also, lived experiences as well. Lived experiences and wisdom sometimes comes through very hard and rough situations. And so I'm excited about what this conversation will produce. And so I see you brought someone with you for this.
I did. I brought my friend and my colleague, Dr. Shoyinka. She is the medical director with Ingham County Health Department. And I thought, since I'm going out, this is a great time to have a conversation about, are you signing up to get your COVID vaccination? And so I wanted to make sure I had some wisdom with me, and Dr. Shoyinka provides that.
Welcome, Dr. Shoyinka. How are you?
Thank you. I am well. Thank you for having me here. This is an honor. Yes, Debbie is leaving me. And I'm really trying to come to terms with that. But yeah, I have 2 days left. It's a pleasure to be here, and I'm happy to talk about this topic, which is near and dear to my heart too. It's important.
Yeah, and just a little bit of background on you. You're currently the medical director, but you have a background in infectious diseases and public health, and so you are perfect for this conversation.
I'd like to think so, yes. The things that I'm passionate about, yes.
Great. So let's hop right into it. And I just kind of want to get the basics out of the way. Either of you can answer, whichever one feels it on your heart to answer these questions, but just so we're all on a level playing field. So let's start very basic. What is a vaccination?
So when you need a vaccination, you are looking for some kind of immunity, some kind of protection from some kind of disease, an infection, right? All of us here, I'm sure, have gotten vaccinations as children and as adults. The more common one that everybody can remember that we talk about the most is the flu shot, right? Which is the influenza vaccine. And what a vaccine does in any form when it is injected into the body, it is a form, a representation of the organism, the bacteria or virus that causes the infection, but it's not the real thing. Usually what it is, it might be what they call an attenuated vaccine, which means that organism has been weakened, or it might be a portion of that organism, so not the whole thing. And when that is put into our bodies, it is presented to our immune system. When our immune system sees that, it recognizes it and develops that, what we call that immunity. So the next time that the real thing shows up, your body is ready to fight it. And so you're less likely to develop a full-blown illness. So when we talk about measles, for example, which can be really deadly, if we have the portion of it that has been presented in our bodies a long time ago, when the real thing shows up, we are less likely to get the measles infection. Likewise, something similar with the COVID vaccine. There have been more development as to what that looks like over the years, and I'm sure we're going to talk a little more about that.
Thank you for that explanation. Are all vaccinations or vaccines created equal?
No. So that's kind of where I was going with in terms of the kinds. Some of them are the virus that is killed. Some of it is a portion of the virus or the organism, because it could be from a bacteria. Some of it could be a created material that is similar to it, but they all have different forms. The more recent form is the COVID vaccine that everybody has been talking about in the context of, the mRNA vaccine, which is kind of new because what we've been using before are really more like vector related vaccines. The ones that I explained, the example is, the flu shot or the measles, where it's the organism itself that is presented either killed or, weakened. And so that's where there's a difference. The mRNA virus is the one where you have just the mRNA vaccine, is where you have just a small portion of that virus, of the mRNA piece of the virus that called the spike protein. And that is what is put into the vaccine. So it's not the full virus in any form. It has no potential to make anyone sick. It's not complete enough to even do that. And so when that's presented to the immune system is able to boost a response, so to speak.
So when people hear mRN, do they automatically connect that to COVID? Because I want to make sure that when you're saying these things, people hear and they really understand what you're saying. So just for our listeners, we're connecting those two and just wanting to paint a clear picture again to make sure we're on the same page. If a virus, if a disease was made up of several components, like several spokes of a wheel, that's what this virus looked like visually.
Right.
What you are sharing is that what is in this vaccination is maybe one spoke or two spokes of the wheel, whatever it is, it's enough for our bodies to respond, to build up some type of defense system to say, hey, in the event, we encounter the larger wheel, we're more prepared for it.
Right. See, you don't even need me to explain this. You got it down. Look at that. See, so you are correct. That spike protein is a very small piece of the coronavirus. Since we're jumping into the COVID conversation already, it is a piece of that COVID-19, that SARS-CoV virus that we've all been talking about for the last 1 year. And it's a tiny spike, like you said. It's not necessarily the spike on the top of it. We've all seen the image of the virus, right? But it's this tiny protein piece, and that is what our bodies recognize when it goes in. So that when someone coughs in your face or whatever, and you are presented with the real thing, your body says, "I've seen it before," and you don't get as sick is the expectation, or at least you are not able to spread the vaccine. And some of those things in terms of how effective and what exactly, how well the vaccine works, we don't have all the information, but we know that it can prevent people from getting COVID vaccine once they've been vaccinated twice.
And that's kind of what I wanted to transition into, is really the concerns within communities who have been, or communities where there's a history of mistreatment, where there's a history of, destructive behavior, to say the least, towards communities from the medical, community. And so all of these concerns arise, and it's not just say the Tuskegee experiment. It's the consistent structural racism that we see that gives Black folks all the right to have these concerns and hesitations of trusting, an entity like the federal government, or trusting, a for-profit institution, right, that's pushing out vaccines and medicine. And so as we transition into some of those concerns or cares, how do you address that? I don't trust it, like, period. Like, I don't trust it. Why should I trust medical professionals? And I don't believe it's personal, but again, it's historical, and it's an institution who have consistently and still show me to this day that they don't care, or they don't do the due diligence as it relates to my community.
That is correct. You're right. It's not just Tuskegee. It's what everyone experiences every day. Black people are more likely to have higher maternal mortality, more likely to have higher infant mortality, are more likely to have, more cardiac issues. And of course, if we go into COVID too, we all know that a Black person is 2 to 3 times more likely to, experience the infection, experience the mortality, or die. So there's a lot of history, and there's a lot of, there's a lot of personal experiences that go with that. So it's justified. That mistrust is definitely justified with people of color. And one important thing to emphasize is that, we know that we're affected the most, right? And so where do we go to reduce the numbers of that mortality? The question is, does the vaccine work, or is there something, else behind it? There have been stories about this mRNA virus and how it's going to, alter DNA and things like that. And so those conversations add to the mistrust, which can be general, or they can be, focused on people of color too. One of the things that I want to, mention or, Debbie and I have been vaccinated. I mean, if that's, a number one thing, and as we've heard about what the science tells us with regards to the trials, we can see that there is evidence that it works, right? And so we continue to share that as we see, there are things that we don't know about the virus, and we will be about the vaccine, sorry, and we'll continue to share what that looks like as we keep, as time goes on. But for right now, the vaccine has been tested in, at least for one of them, we know there are two vaccines out there. Each one tested about 40,000, 30,000 people for each one, right? And in those places, they had people who got the placebo, which is, something else other than the virus, the vaccine, and then people who got the vaccine. In people who didn't get the vaccine, there were about, out of that 40,000 people, there were maybe almost 200 people who got sick and who got the COVID infection. And in the people who got the vaccine, only about 8 of them got the infection. And then even if you look amongst those two groups of people, the people who got the vaccine who got infected were not as sick, didn't have severe illness compared to the 162 somewhere in there for the Moderna that did get sick. So some of those things, when you look at the data, it speaks to how well the vaccine works and the fact that there's something to support the fact that we should get it.
And so it's something you said, and I don't want to start like conspiracy theories. I just want to be really clear. And I understand how people can hear one piece of information and take it and run with it. So I want to highlight it, but I also want to bring some clarity to it. And so even with that 8 among the 40,000 people, I can hear someone saying, so it really doesn't work. How can you be sure? And so can you respond to that?
Sure. So again, the vaccine is not promising that it's 100% effective. That's not what the data shows us. The data shows us that it is about 95% effective in preventing infection. So what we are looking for is 2 things. One, we're looking to increase our immunity. One, to hopefully prevent infection, and 2, reduce the severity. It's really not about getting sick, right? There are a lot of people who have gotten gotten COVID and were fine. We have people who were asymptomatic and didn't even know they were infected, right? We have people who had, felt like, oh, I was sneezing a couple of days and then went and got tested and they were fine, right? But then we have the people who ended up in the hospital, and then we have, who were really sick. And then we all know people who have passed away from this. So that is what the vaccine does, right? It's reducing the severity of the disease is the critical piece in there. As time goes on, like I said, we will know more. There will be more vaccines are coming out that might be even more effective, that maybe we can say, oh, it has 100% efficacy is the word they use, or it's 100% effective. And so therefore people won't get it. The other important thing is that as a lot of people come together and get it, then we have what we call herd immunity, right? And that reduces the risk of a lot of people getting infection because there's a lot of immunity in the community. So people who can't even get the vaccine for legitimate reasons are protected too. So I hope that answers the question in terms of those 8 people who got it, even though they got the vaccine. There could be other reasons why they got infected, depending on what their exposure was, at what point in time they got the vaccine versus the time they got the exposure. But again, the purpose is not necessarily preventing the infection itself, but it is to reduce mortality ultimately and all the subsequent really bad things that can happen as a result of COVID.
And you mentioned effectiveness, right? And you mentioned that we're still learning things
A lot.
about this virus. We're still learning things about the vaccination. And so I could see someone, it makes sense to me, like, I'm just going to wait for version number 5, right? You know, I'm going to wait till y'all get all the kinks out until you come back with the vaccine that works the best.
Right.
Is that a good strategy?
It's not. I can totally understand why anyone would think that way. Everyone wants to be safe, right? We do know that what we have right now, when I say there's a lot we don't know, it's not about the safety of it that we don't know about. It's not about the effectiveness, so to speak. When I say we don't know about effectiveness, I'm talking about how long does that last me? How long is that immunity going to last in my system? We just haven't had people who have gotten the vaccine long enough, right? We don't have that benefit of time, which kind of circles back to why people have had a lot of distrust about, how long it took to roll the vaccine out and things like that. Those are the reasons why, because they're just done longer so that there's more information. So to answer your question with regards to effectiveness, we know it's safe and we know it prevents it. We just don't know how long, because we haven't waited that long to figure out what immunity looks like. But the truth of the matter is that the more you hold out, you're still at risk of infection, right? Which it's really hard to tell who's going to get really, really sick and who isn't. There are people who did not have any immunocompromise, or at least didn't know about it, and did not do well. And so there's a risk in there, which, is everyone's to take. There are different variations as to, we know there are a couple of other vaccines that are coming out in, soon. I can't give an exact number to what that looks like, but there are different forms too. Remember I talked about, the mRNA vaccine versus the vector type. And so they're yet to be seen as to what that effectiveness is. I know that one of the companies that is doing, I think it's Merck. Merck just scaled back on a couple of the vaccines that they were working on because some of the data didn't work. So we don't know how soon those other things are going to come out. So you might be waiting for a while and keeping things to.
And one of my concerns, again, this conversation is open, but also one of my concerns when we have that hesitation within the Black community of deciding not to, move forward with the vaccine is that we are going to slowly but surely, God forbid, but we are going to eliminate ourselves because we made the decision I want to say the informed decision, but based on history, based on my last doctor's visit, when I had to visit 3 doctors, and the doctor that I finally got was a Black woman, and she understood the nuances of, maybe the Black family or the environment or whatever it was. But if I include all that, if I put all that together and make a decision about what I believe is healthy, what I believe is smart for my family, and I hold off and I don't get it, my concern, and I've had this conversation with a couple of friends, and they brought it to my attention, is that we are the most affected by the COVID virus already. And in 10 years, half of us could be gone because we decided not to take it, right? And we don't have that luxury as Black people. So how is the health department somewhat responding to that truth? Because you could have two crises on your hands, like the slow, I don't want to say elimination of I'm not saying like all Black people are about to disappear. I'm not saying that, but I am saying that families are going to potentially have one of their providers gone, right? A family could slow, right? If we think about the role of Black women in our families, some of them are the providers, they are the caretakers, they are the teachers, they have so many responsibilities and I'm just talking about within the home. I didn't even go into the community, right? I didn't even go into your job. I didn't go into your church. I didn't go into where you volunteer. I didn't go into any of that. So if just one woman, right, who holds the role of a caretaker, maybe she's taking care of her mom, maybe she is a mother, maybe she also has a job where she's supporting the entire family, right? And she contracts COVID. And so she's down for 6 to 8 weeks. Then you have this domino effect within your family. So I'm concerned about that perspective.
So I just want to add, when we look at the statistics, Black folks, we're dying probably twice that of our white colleagues or residents or citizens. And so I think it's really important. When I made the decision to get the vaccine, it really was about I caretake for my mother. I watch my grandbabies. I do volunteer work. I have a husband. And if I'm down, everybody down. That's it. We don't stop functioning. And so I think making the decision of thinking about what could happen. And I think it's important that people stop and take a moment to think about what could happen if you're not here. And so I think it's really important. And I think our role at the health department really is about how do we share with them all of the knowledge and what we know. I think about with some of my friends, we joke sometime about sometimes we want what they have, but it's the bad stuff. And so the good things that they have, which is like the vaccine, we're, and I get it. I know why we think that way. And so what I want, or I'm hoping what our message is that this is the good thing. It's not by no means the cure-all, or as Dr. Shoyinka said, we look at it how it increases our immunity or it reduces the severity of the disease. And I think that is critical because oftentimes our brothers and sisters, we have other physical ailments that impact us. When you get COVID on top of that, the impact is great. And so how do we lessen that severity if you get it? And how do we build up or increase our immunity, not just ours, but in our community? So that for some of those who really can't or don't want to get it, will still see the benefit because we have got the vaccine. Yes. And so the health department's role really is to get that out there and give people more information to know that this is the right thing to do. The consequences of the benefit of getting the vaccine, and then providing opportunities for those who want to get it to get it.
I just wanted to add, though, that, one of the important things that we want to do at the health department too is be open about what we know and what we don't know about the vaccine. We want to be open about what to expect when people do get the vaccine. There's been a lot of talk about, what side effects look like or could look like. And so we want to be able to share that and, at least be an open space where people can access that information so that we know exactly what we're getting, at least, in the immediate and what those supposed pros and cons are, which, of course, the benefits definitely outweighs any risk of whatever side effects could be experienced.
And so this was a natural transition. We have talked about the pros for an individual, for a community, for a nation. But what are the cons? You want to be open, you want to be honest. Like, this is a possibility of what can happen if you decide to move forward with the vaccine. Can you talk about that?
Sure. So, the CDC does give some guidance as to who should get the vaccine based on what we know right now and who shouldn't. They do share that if you have any severe allergic reaction, like anaphylaxis, like, throat, when we talk about anaphylaxis, we're talking about like, throat swelling and, can't breathe kind of thing. Like, people who have, who get reactions, I don't know, like a bad shellfish allergy kind of thing. Okay, so that, but if they have a severe allergy to any component of the vaccine, then they're not supposed to get it. That's one. If they have had, however, a severe reaction to some kind of vaccine, any other vaccine, the measles, mumps, and rubella, the influenza, whatever, they want you to share that information when you are getting the vaccine, so that, or when you present. And so that needs to be discussed with the provider, right? To make sure that the administration of the vaccine is in a controlled environment. And so they have everything they need to, just in case. We at the health department have given vaccines to people who are allergic to other things, and they've been fine otherwise, or might have had mild reactions. Now, that's for people who have allergies. So knowing that you have allergies is something that you want to discuss, or at least put out there when you decide, if and when you decide to get the vaccine. The other piece is people who don't have any history of any kind of allergy, but side effects are not uncommon. The more common thing is, the soreness on the arm where you got the shot. That soreness could last, for a little more than a couple of hours. Some people would, by the end of the day, feel like taking some kind of Tylenol or something to relieve that. On the other hand, some people get more severe side effects, fever, feeling tired, feeling fatigued, muscle aches. And usually that lasts for about, it could last for like up to maybe 24, maybe 48 hours in some cases. And then like a flip of a switch, it stops. At least that's kind of similar to what I experienced personally. The CDC does have when people get the vaccine, there's a app that they were supposed to sign up for, and the CDC kind of does a monitoring. It's kind of like a allergy or a reaction side effects support thing. So it kind of, once you sign up for it, you will get like a daily monitoring question, kind of saying it's time to check in for your vaccine. It's called the V-Safe. And so that's somewhere where, if anything were to, there's kind of like that direct connection to the CDC if there were anything. But overall, there hasn't been any major, nobody that I know or have heard of, in the news or has been reported, like there's no death, there's no, severe, permanent, damaging reaction that we've heard of. There have been some people who have had severe anaphylactic reactions, but in some of those cases, it's not entirely clear whether all of it is just related to the vaccine.
That's good to know. And also, so I know we're talking a lot about this vaccination to inform the community, to have an educated conversation about this from the experts, from those who work in this field. But I also want to make it clear, and I think in our conversation somewhat behind the scenes, that the intent is not to pressure, right? The intent is not to pressure. And I believe the Ingham County Health Department has a stance on how they're moving forward with communities that are hesitant. Did you guys want to share a little bit about that?
Yeah, so we're trying to do what we can in terms of educating the community, making one of our goals, let me start by saying one of our goals at the health department is to ensure equitable distribution of the vaccine for whoever wants it, regardless of, where anyone is from. We're making a lot of efforts to reach people who are harder to reach overall. Whoever does want it can get it, but it is not something that we're forcing anyone to get. We are not insisting that anyone gets it, but it is available to whoever wants it, even though in limited supply right now. But the goal is that anyone in Ingham County, as our vaccine becomes more and more available, will be able to get it. I don't know if I answered your question. I feel like I kind of went off a little
No,
bit.
I think you did. I just want to add, just to follow up and to reiterate again what Dr. Shoyinka said, and that is that there is no pressure. That there's something very freeing about options and choice when you know that you have a choice. And so I really feel like what we are hoping to do is to provide opportunity, provide information, and just the access. And so we're trying to reach out to all of those communities to let them know that should they make that decision that this is what they want, that they are able to get it and they have information about what it will mean and the side effects or whatever may be happening. So that's really our goal.
It sounds like it's all about respecting individuals' autonomy, but also staying in the conversation, because this is something that affects you, affects your family, affects the world, and it affects how you show up in the world. So at the minimum, stay a part of the conversation so you can continue to make an informed decision that you believe is best for you and best for your family. And so if someone is interested in staying a part of the conversation, if they are interested in potentially even signing up to become vaccinated, what are the next steps?
So right now, the health department has one main source of vaccination. We're running a vaccination clinic at MSU Pavilion. And so in order to do that, anyone who is interested should go to the Ingham County website and register their interest. So on that registration form, name, contact information, and a few other questions will be asked about, age, things like that, to figure out where exactly you fit with regards to that criteria that is set up by the state, in terms of our priority list. If there are any limitations in terms of, people who do not have internet, who do not, have email, because when you fill out those forms, ultimately the health department will set up an appointment and you'll get an email that will give you the information about when your appointment date is. For people who do not have access to email or don't have internet, there's a phone number to call to leave a message. And we go through all of that. The health department staff go through all of that and get back to those people in order to make sure that they're registered. So as we get vaccine available at the health department, which I must say has been, limited. I'm sure everyone who has been listening to what's happening in the news knows that, the allocations have been, limited is the word I will use, and sparse. And so we're working with what we have. So as we get more, we keep scheduling those appointments and getting them out. I can share the number too. It's 517-887-4623. That's 517-887-4623 is the number. And you would find that number on the health department website too. And you can leave, questions, whatever it is, and somebody will get back to you eventually.
And we'll include the information as well on our show page. So if you're listening maybe through your favorite podcast app, you can always head to thegoodgirlpodcast.com and just head to this show page and it will be listed. And so I thank you all for this very informative conversation. I think a needed conversation, starting from the basics to where we are, to what we don't know, to here's what you can do. So folks at the end of the day can make a good decision, can make a great decision. Thank you again, Dr. Shoyinka. Thank you, Debbie Edokpolo. Congratulations. A round of applause. Woo!
Thank you.
Do you have any words of wisdom you would like to leave us with as we close out the show?
Yes, I would say do all you can to collectively, all of us collectively, I believe it was Anne-Marie Brown talks about the little things that we all do. And if we all do our own little part, whatever that is, we can make a big difference. And so be it we all little ones get vaccines, or we all begin to talk about how we make sure that everybody has what they need to be successful. We all do our little parts to help that. that we'll have a better world to live in. And so that's what I believe the Ingham County Health Department is trying to do. They're trying to do their little part. So thank you for having me. Maybe when you'll have me back in post-retirement, and who knows what I might have to say.
Listen, don't play with it.
All day.
Thank you too so much for being on the Good Girl Podcast.
All right.
Thank you for the opportunity.
For more information on COVID testing or vaccinations, or just to stay up to date with the latest COVID information, head to hd.ingham.org. That's HD as in health department.ingham.org, or call 517-887-4623. That number 517-887-4623 to register your interest in the COVID vaccination.